And welcome back to WCI TV, sponsored by Tower MSA Partners. I'm Bob Fryer, and joining us in studio, a rare double event. This is fantastic. Elizabeth Lowry, she's the Senior VP of Risk Solutions at Paradigm, and Dr. Michael Choo, he is the Chief Medical Officer at Paradigm. Good to see you both.
Good to
Great
see you,
to have
Bob.
you here. Enjoying your time at WCI so far?
Absolutely.
Has been
Absolutely.
wonderful. Thank you,
Sure.
as usual.
Good. So last year, you introduced MSK, HERO MSK. Can you
Correct.
talk to me a little bit about, again, what it is that it does and how far we've come in the last year?
Yeah, Bob, thank you. A year ago when we talked, we had just introduced the HERO MSK program at Paradigm. And some of the core tenets of the program is that much like we offer in our HERO catastrophic outcome plans that we've been doing very successfully for over 30 years, we are offering a guaranteed outcome and a fixed price for musculoskeletal injuries and surgeries, which is revolutionary in the industry.
First of its kind, right?
First of its kind, a true value-based care solution in workers' compensation for a broader set of injuries.
Okay, and where are we now? How far have we moved ahead?
Well, we actually have multiple customers that are already
Terrific.
through implementation, that we're successfully running the program, and we have several others onboarding at the end of this year. So we're really excited about being able to prove out the wonderful outcomes of this program.
Dr. Choo, 1 year, that's some great results in a short period of time. Why do you think that is?
Well, Bob, I think as Elizabeth mentioned, the key differentiator for our HERO MSK product or solution is that it's really an extension or expansion of our outcome-driven, results-driven, value-based reimbursement model. And why I say that is because I think we all of us know that one of the biggest barriers or problems that exist in our healthcare system today is the fact that it's based upon a more traditional fee-for-service reimbursement model, which unfortunately over the years that has conditioned the providers to focus on volume and activities rather than the results or the outcome. So what we have done is actually what we learned from our catastrophic injury value-based care, where we actually guarantee outcomes for a fixed price. We've actually extended this now to musculoskeletal conditions, where we're now teaching providers now to think about and focusing on the results rather than the activities, so that we can achieve the better results faster, and it's actually good for all stakeholders.
Well, it sounds like it's a win-win for everybody, but how does it help maybe in the recovery process? How does that work, and how is it different from what everybody else is doing?
Yeah, it's a great question. So being results-focused or outcome-focused, what it does is that what we do is that we actually try to develop a very trusting rapport with the injured worker as quickly as possible. And what that does for us is that it allows us, using the tools that we have, allows us to identify you heard this before, the psychosocial, behavioral, and medical risk factors that can actually impede progress. The barriers that actually prevent the recovery from taking place very efficiently. So obviously that allows us then to, once we re-stratify and identify those factors, then our network managers or our team is able to work with the injured worker to try to mitigate the impact of those risk factors, so that it allows for the best, recovery and rehabilitation and the outcome.
The way I was describing, you were just describing it, it sounds like it is a win-win for everyone, but maybe that's not always the case. So is HERO MSK, is it for everyone?
That's a great question. This is a very innovative product. I mean, it's the first of its kind, as you mentioned earlier, in the marketplace and in workers' compensation. So you have to have, I remember you telling me, Dr. Choo, to do a value-based program, you have to have courage. And that's the willingness to take risk, knowing that your model is going to provide that outcome for the injured worker. So we are looking for people that want to change the model, the design of workers' compensation, wanting to do something meaningfully different in their programs. It's a little scary, but we are already proving out some fantastic results, financial results, faster release to return to work, just overall better outcomes for our injured workers, which in turn results in a better outcome and cost savings for the clients that are working with us.
Well, it just sounds like an amazing first year. I can't wait until WCI next year and find out how much further HERO MSK has gone.
We are very excited.
I can give you a case example.
Sure,
if you're
please do.
So we actually had a case. We had a 62-year-old waitress who slipped and fell fell while at work, and
Yeah.
she hurt her shoulder. Went to the emergency room, and it was determined that she probably had a rotator cuff tear. So she got referred to a surgeon immediately. And when she got there, and when we got pulled in, during our, using our assessment and through our tools, we discovered that she had a number of psychosocial and behavioral risk factors that weren't not known at the time.
Oh.
So we identified the fact that she had underlying depression, which was obviously affecting her emotional health. We also found out that she had a history of some substance abuse in the past, and she was penchant to opioid use. And then we also, medically speaking, she had some risk factors that included tobacco use and elevated BMI.
Gotcha.
And so we were able to actually work with our network manager to help the injured worker mitigate those risks. And we also communicated that with the treating surgeon, so he also helped us actually to wait until we could mitigate those risk factors so that when he finally took her to surgery, that even his outcomes look better.
That's
and
right.
to Elizabeth's point, this case progressed pretty rapidly.
Yeah.
And I think the lady was able to return to work 2 months before the ODG benchmarks would say that she was going to return to work. About the time she returned to work, she was not needing any opioids, and also she actually had no depressive symptoms at all, which to me I think is fabulous.
That's huge. That's amazing. Dr. Choo, Elizabeth Lowry, thank you so much.
Thank you
Enjoy
so
the
much,
rest of
Bob.
your time here at WCI.
And it's a pleasure meeting you, Bob.
You as
Yeah,
well.
Thank you.
And for
Thanks for your time.
WCI TV, sponsored by Tower MSA Partners, I'm Bob Fryer.